afternoon. Welcome to the TV Spot on Light session. Now we have something very important and something very new. We have a possibility to see a presentation about the rethinking and reshaping the guidelines in the future. The ESGE is working on novel development and presentation application for guidelines, with the first guideline like this appearing at the end of this year. My name is Monika Ferlitsch. I was involved in many guidelines developments of the ESGE in the last 10 years. And for me, it's also very interesting and be a part of this session. And now I would like to invite Konstantinos Triantafyllou to give his talk. And please stay with us for the discussion thereafter. Kostas?
Okay. Thank you, Monika. So looking forward to see my videos.
Hello, I'm Professor Konstantinos Triantafyllou, the chair of ESGE Guidelines Committee, and I'm going to present you a new application with which ESGE will develop and present the guidelines in the near future. This will be a trustworthy evidence platform using established guideline standards like the GRADE methodology with the latest technology, intuitive design, and emphasis on open and linked digitally structured data. We will meet ESGE business need for a living evidence engine to drive healthcare change. And we will serve clinicians, patients, authorities, and other stakeholders with updated, shared, personalized decision aids. This is the magic platform. This is our trustworthy evidence platform with which we will formulate the PICO questions, we will find outcomes across studies, make evidence profiles, and go from evidence to recommendation in order to formulate a recommendation, and finally to publish guidelines, evidence summaries, recommendations, decision aids, and many more in a structured way. Structured guidelines will be developed using standard data fields and text automatically suggested to speed up development and encourage consistency. The standard management of guidelines components, such as references, PICOs, and evidence profiles, will reduce wasted efforts and ensure consistent results across recommendations. Guidelines will be incrementally updated as new evidence is accumulating and will be published seamlessly across channels. Evidence within the platform is designed for reuse, allowing authors to quickly incorporate existing evidence into new or updated guidelines. Thus, we are going to move ESGE guidelines to the living evidence model. Application is designed to publish guidelines across a variety of platforms. Content will be tagged using standards in order to organize and display relevant results. And when content is updated in the platform, it is automatically updated everywhere that connects to the platform. And what our end users will get. User decides the level of details needed using the multi-layered framework. Most useful information is on top. Recommendation is up front, but user can dig down to layers of information all the way to the primary study information that is underlying the effect estimates for each outcome. We offer structural recommendations with the rationale behind the recommendation, the key information, quality of evidence, and evidence inherent. We offer easy navigation, graphic presentation of evidence, graphic decision tools, and the platform is available for personal use for exploring, learning, and teaching. And to end up, in this graphic, we present all the tool that we are going to use. So the team, the guideline team, will dynamically update every evidence, new and old evidence, to create structure and content tagged database. And this information will be developed in guidelines, and it will be presented in multi-layered formats for all devices. It can integrate it to patient's record. It can adapt it for national and local guidelines and even textbooks, and it can be used for decision aids for patients and clinicians discussion. And at the end, I would like to thank the governing board and the executives of the ESGE for giving me the opportunity to work with this project. And I would like also to thank the colleagues from the MAGIC, the people who developed MAGIC, for giving us this valuable tool. Thank you very much, and looking forward for the discussion.
Thank you, Kostas, for this excellent presentation given online. But I have some question. Which are the needs for this change? Because we have all the guidelines which we update all the times. Why do we need this?
Yeah, we are endoscopists, we are physicians, so we are amateur in the field, but we are doing professional work. And with that, I mean that we develop and publish guidelines, which is something that requires professionalism. With this application, with these tools, we move from, we mature and we become professional because we work with professionals. So it's not something only a changing or incorporation of an application. It's a mindset, and I'm privileged to be involved in this project because it doesn't happen every day. So we move from the plain writing, for example, right now what we have? We have the PDF. What is the PDF? The PDF is paperwork, or is a digital document which has beginning, middle, and end. And if you take it in your hands, you have to go from the beginning, the introduction, the methodology, blah, 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 blah. And then we now move to modular writing. What does it mean? That someone...
Do you mean that PDF is over?
No, PDF will not be over. PDF will continue to exist. It will be the stones of Moses, but modular writing will be something different. So we move to modular writing, and this is that modular writing is that every part of the document can stand alone, and it can be reviewed and revised on time. So just imagine you are now working on the revision of the update or the guideline on polypectomy, aren't you? And you complete the work during this year or early next year. And in 1 year, for example, the FDA or the EMEA decides to take out of the market one of the solutions for preparation for safety reasons. What will you do? Will you amend the guideline? Currently, it's impossible. But with modular writing, you can do it. So you go directly to the module of bowel preparation. You take out, you insert the new evidence, and you go probably to the recommendation, update the recommendation, upgrade or downgrade it, and change the level of the evidence. So we move from using modular writing to a living evidence document. That means that in our site, in the ESGE site, the guidelines will be updated, constantly updated. And I don't mean that it will be updated in every moment, but as soon as some evidence, some crucial evidence arises and accumulates, then you can post on the site and update. And this will be for the benefit of the reader, for the benefit of the clinicians. And when a large amount of new data accumulates, then you as the leader, you decide to fully update the guideline, and then you have the new PDF. So it's amazing from the part of the writer.
Yes, it sounds great, but as a guideline author, how can I benefit from MAGIC app? I cannot just put a new evidence and the new evidence will not change the statement. I still need I still need the guideline, the statement for the guidelines. I still need to make a meeting with the people who are involved in the guideline. How this should work? It's just not one published paper or something. Can you explain the living?
Sure. First of all, it means that when you complete your publication, you're not over. You're not sent home. So you follow the publication, you follow the guideline, you and probably a couple or three or more people from the task force, you follow the publication, and when you identify something that can change, can really make a change, I mean, change the recommendation or change the grading or the level of evidence, then working with these people, you develop the new statement with the new grading, the new level of evidence, and you post it using the MAGIC application. So you have a new, you have put the evidence table, you may change the evidence table, and you change at the end, you may change the recommendation and the grading and the level of evidence. So you have a new guideline. Moreover, working with the MAGIC people there, you will find that they are really magic. I mean, they offer fantastic help. We have a methodologist, at least one methodologist with us. We have expert statistician that will help us perform all the statistical work, meta-analysis with RevMan, network meta-analysis. We have people who will assist on formulating the tables of evidence, and then immediately from the table of evidence, we can develop a graphical presentation of the recommendation, graphical presentation of the data. Then you feel that you really, the author feels that he or she is doing something new, something very creative.
So you mean that the work for the guideline leader, which will be much easier because we have many professional people, but the work on the guideline is now over with publishing the guidelines. We have to stick on it until the next update to make the update within of the MAGIC app, and how the guideline reader will benefit from the app.
Okay, yeah, this is for me it's much more important because you know we have this modularized writing, and we have the let's say the most important thing of a guideline will be first. What is the most important for the reader? The recommendations. So when he clicks on the guideline, immediately all the recommendations appear, and then he can pick a recommendation, look at the grade of the evidence, look at the level of evidence, and then he can even dig down to the supporting evidence, the supporting data, to the tables, to the analysis, and then to the references. So it's more easier for the reader instead to look around in a whole document to find his relevant the information which is relevant to him. He can find it up front. Okay. Very, very easy.
Okay, thank you, Kostas. Now I understand it. But when do we start? When will the first guideline in the MAGIC app appear?
Yeah, the whole process has started long before, because we have to find this application, we have to test it, retest it, and feel out that we are ready. And now we are ready, and hopefully the first guideline to be published with the MAGIC app will be the BARS guideline, which is prepared by Vas Wösten, and hopefully it will be done by the end of this year. At the same time, we are working on the already published guidelines. So we have dedicated people that they will put the already published guidelines, at least the recent ones, on the MAGIC application. So by the end of the year, we will have at least one guideline. Probably it will be the esophageal standing guideline, which is one of the most recent guidelines appearing with the MAGIC application on the side of the ESGE.
Okay, thank you very much. So I need the MAGIC app. Thank you very much. Thank you for being with us. I wish you...
Thank you for inviting.
Yes, thank you for inviting. And Kostas, thank you for a great presentation and for a great discussion. Thank you.
Thank you. Enjoy the rest of the meeting, and bye-bye.
Bye-bye.